Hi, everyone. I'm Mandi Gross, and I'm the family lead for the Prompt Initiative. And I'm here to talk to you today about a checklist that our family group made for patient and family engagement in obstetric and neonatal health. This checklist will hopefully help you all be able to earn your family engagement badge that we talked about at one of our coaching calls. And it will appear on the STAR certificates of hospitals that go above and beyond for patient and family care. So this checklist includes three sections: preparation, implementation, and sustainability. So hopefully there's something on here for all of you, whether you're in the preparation stages, just beginning your journey, thinking about what you want to do, to implementation when you're going to be actually starting to make change, to sustainability, where you have an up and running PFAC and you're just keeping it going. So I'm not going to go over all of this checklist. It will be available to you on our website, but I'm going to go over some of the high notes. And then I'm always here to go over anything more specifically with you if you'd like. So to begin in the preparation section, this is where you're going to start getting buy-in from executive level leadership. And we talked a little bit about satisfaction scores last month and how hospitals that have more patient involvement tend to have better satisfaction scores, which lead to patients choosing your hospitals again or recommending your hospitals. So that's a great way to get buy-in. Also, better patient outcomes is always a good thing to strive for in a hospital. This is also the section where you're going to designate a staff liaison. This is going to be the person who eventually will be the go-between your hospitals and your advisors. They're the friendly face in the room, the person that sends out the meeting invites. They should be knowledgeable and friendly, and always the go-between the hospitals and the patient advisors. They receive emails, they send the emails, and they're the advocate for the advocates. Um, then the next section is implementation. And that is when you're actually going to get to the nuts and bolts of planning. You're going to say how big you want your PFAC to be, how many advisors are going to be on it, the structure of it, how many leadership roles versus just council members, recruitment, where you're going to find all of these people. Um, some suggestions for recruitment could be the Mommy and Me group in your hospital or patient satisfaction surveys. You can ask them if they would like to be on a PFAC or if they'd like to share more information. You can ask nurses or doctors if they've had any friends who've come through the hospital that don't work in the hospital that would like to be on the PFAC. Or, and this is also the section that you would talk about meeting frequency, um, whether or not it's going to be monthly, bi-monthly, or anything else, and if it's going to be virtual or in person. So all of this is very dependent on your hospital. There's no right or wrong. There's major, large hospitals that would already have PFACs. So those people would just be part of maybe that big PFAC or maybe a women's and families offshoot. And then there's little hospitals who don't have that many people, who maybe you only have a couple people on a women and family only PFAC. And all of those are great. It's just whatever your um, hospital's capacity is. And I'm here to help you determine that if you would like some help. This is also the stage where you're going to start making change. You're going to start holding your meetings and updating documents. And this is why we're all here. So this is a very important stage. Um, Once all of that is going, then you're into sustainability. You want to always take temperature checks. Sometimes we get in the rhythm of having a PFAC or an advisor, and we forget to assess whether or not everyone's still happy and if anything should be improved. So that's this section. And then also, it's always important to report back, track accomplishments, let everyone know what is happening, that you're passing their suggestions up to leadership, that it is making a difference. Even the smallest change could make a big difference in a hospital stay for someone. So celebrate the successes, big or small, and hopefully everyone will be happy and successful. And I'm here if you ever need any help. Thank you.